Isaac had a perfectly normal birth and childhood, hit all of his milestones on time, and then after he turned 2, we started noticing some strange things that we couldn't quite put our finger on, but we just knew something was happening. It was things like he gained a lot of weight really quickly. He developed a lazy eye and a very strange breathing pattern when he was sleeping. So by the end of July, we put the kids to bed, and a few hours later I went to go check on Isaac, and I knew something was wrong. He was breathing really funny, and he was completely drenched in sweat. His breathing sounded very rattly and wet, and we could just tell that he was struggling.
Isaac is now 3, but he first presented in the summer of 2018 to our PICU, is where he entered into CHAD and spent quite a bit of time in the PICU. I think he came end of July and didn't go home until November.
The team at CHAD was incredible with listening to us, explaining the options, what certain things would look like. They spent time in the room with us, with Isaac.
Isaac was ultimately diagnosed with rapid onset obesity, hypoventilation, hypothalamic dysfunction, and autonomic dysregulation syndrome, ROHHAD syndrome. It's a really rare diagnosis. There's only 100 kids worldwide, so 1 in 73 million kids.
I think the easiest way to explain ROHHAD is the thinking parts of his brain work just fine. So he can talk, he can play, be a normal 3-year-old as much as he can. But it's the non-thinking parts of his brain that don't work properly. So things like his heart rate, his blood pressure, his water balance, his sodium balance, his growth, his weight, his hunger and his thirst, all of those are affected.
And that's when we started sitting down with the complex care team.
Yes.
And they played a huge part in us being able to go home.
Right.
Well, we started our complex care program at CHAD in July of 2017. So we've been doing this for a little over 2 years now. Our goal really is to help them stay home, keep their child safe and happy, and sort of meet the goals, whatever those goals are for their child. And it's pretty overwhelming to take care of a medically complex child. A lot of times these families really are doing it all day, every day. And so to support them and make their lives a little bit easier is sort of why we exist.
And they actually came to our home once we were home to mostly reassure us that we were okay and answer our questions. They met with all of the emergency providers in our area. They went to the local hospitals and gave them some teaching about Isaac, about what he has, about what he might possibly need when he comes to the emergency room.
Continually updating his care plan. Whenever we have a question, they're always available. We're getting to the point where a lot of our providers, we have their personal cell phones, which that doesn't happen anywhere else. It's just, they are really invested in Isaac's health, and it shows.
So he was a totally normal, healthy little boy before all of this happened, and was going home with all new medications, diagnoses, equipment. I mean, it was a whole life-changing experience for him and for his entire family.
He has a plan made up from nephrology to go through steps of which medications he can take as needed for a crisis at home.
My role in Isaac's care is really to manage his high blood pressure, which is a result of his autonomic dysfunction, which is part of his ROHHAD syndrome. And so Isaac is on multiple blood pressure medications. He has high blood pressure at baseline, so he wears a clonidine patch, which the family has to frequently change, but he frequently has autonomic storming events, or what we call them. And so during these events, Isaac can get very high blood pressure. And the family has a regimen of medications that they use at home to control his blood pressure in these situations.
We're not calling 911 when things are bad. We're calling 911 when things are really bad. Because we are dealing with his symptoms the best we can. We have been talking with his doctors and what to do when, and we have been doing that. We do have the supplies here. Essentially, it's like a small little hospital room upstairs, a trauma room, because that's how we're set up.
Our main concerns when a child has severely high blood pressure that they could have a seizure or a stroke. And so our goal is to keep him safe during these episodes of severely elevated blood pressure.
These episodes have happened 6 times since we've been home, and with this diagnosis, you don't know if it's just like a little blip that he's going to get some help and come home, or if he's not ever going to come home. So it's very challenging to live with that expectation and having the understanding that we do. You know, there's certain words that will float through your head that when his blood pressure is so high, you can hear things like death or organ failure and all of these things that can go wrong at any time. If the DART team was not there the night that we first ended up into the hospital, we truly believe they saved his life and brought him to the PICU and passed him off to those providers, and those providers kept him alive and kept him safe and brought us to the point of discovering a diagnosis. It's a scary thought to think if we were anywhere else or if we didn't have the care that we did, we would be in a much different position than we are now.
Courtney and I had a conversation about how do you talk to your children about chronic illness, and even one step further, how do you talk to them about death? And that's not really something that we've really had to go through with the family before this early in our relationship with them. And Isaac certainly has a very unique situation.
So child life has always been involved, mostly in taking care of us as a family and giving us the books or some art therapy or things, tools, giving us tools that we can use as a family, and with Isaac.
I know one of his favorite things was the beads. We went to do an infusion one time and they brought out the beads, and the thing is every time you get
A procedure
or say a helicopter ride or a surgery or something, you get a bead, and Isaac's able to fill up all his beads because he's
got a big container of beads.
He's got a big container of beads.
It's huge for Isaac's quality of life that we can take this one trip and see everybody that we need to see, and he gets to stay in one room with some toys or right next to the playroom, and that makes a big difference when you're 3 years old and it's scary and you have all of these people who are interested in you, and he doesn't always understand that they're helping him by poking and prodding him.
That's our hospital. There's no reason for us to go to a different hospital right now. We know everyone. We show up there, even if it's an emergent trip, we show up there. We know all the nurses, we know all the attending doctors. We get hugs when we show up. You know, where else do you get stuff like that?
I keep in really close touch with Courtney and Tom, and I think we talk a couple of times a week, and really just to see them at work, you know, parenting their children, navigating such a really, really tough situation, and how they talk to their children. It's really been just a privilege, really, to be a part of Isaac's care, and I would like to just say thank you for letting me be a part of Isaac's life and your life, and it's really just an honor, yeah.